First slide presenting our Sentinel event by Caitlin, me, Sadie, Sophia, Destiny, and Ashley. Start off by the Sentinel event definition. The Joint Commission, and we got this from the Joint Commission website, the Joint Commission defines a Sentinel event as a patient safety event not primarily related to the natural causes of the patient's illness or underlying condition that reaches a patient and results in death, permanent harm, regardless of the severity of harm, severe harm, regardless of the duration of harm. An event is also considered sentinel if it is one of the following: suicide of any patient receiving care, treatment, and services in a staffed around-the-clock care setting or within 72 hours of discharge, unanticipated death of a full-term infant, homicide of any patient receiving care, treatment, and services while on site of any specific organization, any intrapartum maternal death, severe maternal morbidity leading to permanent harm or severe harm. So basically a sentinel event would be something that drastically affects somebody's life, like death, loss of an infant, suicide, some major event like that.
So next we have the description of our specific Sentinel event, and what our Sentinel event describes is what happens during nursing protocols when they are not being followed due to the staff not communicating professionally with each other or not collecting or confirming necessary patient information, which is why it is important to always ask questions when given orders or to clarify on orders, and also when nursing staff doesn't take responsibility for mistakes or confirming procedures, which can lead to patient mix-up or any wrong procedures that can be done which are being done onto different patients. This is 100% preventable by following and communicating protocols effectively.
What is a surgical, non-surgical, invasive procedure done on the wrong patient? An intentional and preventable injury that occurs during a surgical procedure operating on the wrong body part or side of the body, performing a different procedure than what was planned or consented to do.
Primary causes of surgical error include communication error, consent issues, multiple procedures, and inadequate patient assessment. Reducing surgical errors: implement techniques to reduce distractions and interruptions during surgery, develop standardized checklists to ensure that necessary information and safety measures are available, and conduct a preoperative time to review informed consent and patient identity.
A timeout in surgery is a crucial safety check that helps prevent medical errors and complications. The surgical team all will pause before starting the procedure to ensure the right person, the right site, the right procedure is being done. Timeout will confirm the right patient by not only the name, but the date of birth as well, which would play a huge role if two people have the same first and last name. Timeout also lets any of the team members communicate and address any concerns. Skipping a timeout in surgery is considered a serious patient safety violation, and it will bypass a crucial step to verify critical information like the patient's identity, surgical site, and procedure, significantly increasing the risk of
statistics. It is going to be, in 1996, the Joint Commission created a Sentinel Event policy to help healthcare organizations face the experience and the serious adverse events to improve safety. The Joint Commission's Office of Quality and Patient Safety assists healthcare organizations in conducting comprehensive systematic analysis to learn from these Sentinel events exactly. Since that time, the Joint Commission has maintained and associated the Sentinel Event database with de-identified and aggregate data. The aggregate information, including causes and outcomes of Sentinel events, is analyzed yearly to advance insight into causes of Sentinel events and develop mitigating strategies to prevent harm to individuals under their care. Another statistic is that between January 1st and December 31st of 2023, the Joint Commission received 1,411 reports of Sentinel events. The majority, 96%, so it's about 1,300, were voluntarily self-reported to the Joint Commission by an accredited or certified entity. Most reported Sentinel events occurred in the hospital setting at about 88%. Okay, so some of the discussion questions that my group had come up with and that we had kind of discussed again going further into our Sentinel event is going to be, kind of thinking about what human factors were relevant to the outcome of the Sentinel event. We try to get, the strategy of staff-related human performance factors that contributed to the event. Some of those examples may include, but not, of course, limited to, failure to follow established policies and procedures, inability to focus on a task, unintentional blindness, and the confirmation bias. Another discussion that we had, kind of concluded within the group was the staff properly qualified and currently competent for their responsibilities at the time of this event? And lastly, what was the intended process flow? Was it site verification protocol, instrument, sponge sharps count procedures, and then lastly, patient identification protocol. And pretty much all of these leading up to, of course, kind of what our project strategized on, which was the overall Sentinel event that happened within the doctor's office.